hand over the session to our moderator, Dr. Venkatesh Karthikeyan sir. Sir is Community and Family Medicine PG AIIMS Patna. Sir is State General Secretary, IMA Junior Doctors Network, Tamil Nadu. Over to you, sir, for the next proceedings.
Thank you so much. Very good evening, everyone. I'm Dr. Venkatesh Karthikeyan from AIIMS Patna. I'm glad to see the doctors from lengths and breadths of the country have joined in today's webinar. In the past 1 year, Indian Medical Association Junior Doctors Network has organized a series of webinars for the benefit of our junior doctors. In recent times, we have collaborated with the Ministry of Health and Family Welfare, AIIMS Delhi, IAPSM, CAHO, Star Health Insurance, Max Group of Hospitals, and with many national and international faculties. We got excellent feedback that our webinars are very helpful for our young doctors, and hence we are continuing our webinar series. World Cancer Day is an international day marked on 4th February to raise awareness of cancer and to encourage its prevention and treatment. Half of the world's population lacks access to the full range of essential health services. When it comes to cancer, many of us are denied basic care despite the fact that we live in a time of great achievements in cancer prevention, diagnosis, and treatment. This is the equity gap, and this gap is costing life. People who seek cancer care hit barriers at every turn: income, education, geographical location, and discrimination based on ethnicity, race, gender, age, disability, and lifestyles are just a few of the factors that negatively affect the care. We might feel like the equity gap doesn't impact us personally as doctors, but it likely does affect someone whom we know. While it's more pronounced in low and middle income countries, well-resourced countries show dramatic disparities too. It's almost guaranteed that the gap affects people in our community. The Indian Medical Association Junior Doctors Network, understanding this issue, is organizing the webinar on World Cancer Day, Close the Care Gap. To throw more light on this topic, we are organizing this webinar. I would like to thank our National President, Dr. Sajanan Prasad Singh sir, our General Secretary, Honorary Dr. Jayesh Lele sir, Dr. Anil Goyal sir, Dr. Abul Hassan sir, our National Chairman of IMA JDN, Dr. Parul ma'am, Dr. Shiv Joshi sir, and Dr. Karan Juneja, without whose guidance and support, this webinar series would have not been possible. I would like to specifically thank and invite Dr. Abul Hassan sir, and sir has been giving us constant support and guidance. Sir is a senior pediatric surgeon from Erode, Tamil Nadu. As mentioned earlier, is the national chairman of IMA Junior Doctors Network, and more contextually speaking, Sir himself is running a cancer care hospital for the terminally ill cancer patients. He has served more than 1,150 terminally ill cancer patients in the past few years. He always stands up for the issues faced by the junior doctors as well, and continues his service across different horizons. I'm glad to share that Sir also has recently been elected as the state president of IMA Tamil Nadu. With this short intro, I would like to request Dr. Abul Hassan sir to share a few words with us. Over to you, sir. Sir, you're muted, sir.
Good evening, Venkatesh. My dear Shiv and all the faculties, Dr. Kuratulayan, Dr. Daksh, and Dr. Suresh Kumar, Dr. Siddharth, and also I welcome all the delegates who have joined this webinar on the eve of World Cancer Day. I'm very happy that IMA JDN is doing this activity. I remember that when I organized this Cancer Palliative Care Center from IMA platform back in my place, many people asked me this question: why you are so passionate about kind of doing this kind of activities in the field of cancer? I told all our colleagues that it is a kind of spontaneous response by every doctor to help or to sensitize and make people vigilant about the symptom signs of cancer. And I know you can do so many activities in every sphere of cancer. Now the oncology itself has established as a very good discipline, aiming a very good percentage of cure and survival rate of cancer afflicted victims. So we have to go a long way unitedly to fight this disease. And every doctor of our country has a responsibility to spread the message of all kinds of news about this disease, and make our people feel that they should go to the doctor as soon as they get some symptoms and signs of cancer. With this idea only, this World Cancer Day has been observed throughout the country in various platforms today and also tomorrow. Especially there are so many rallies, cycle rallies are organized even in my place. The whole days I am occupied for tomorrow. All these are done to kind of sensitize people about this cancer, and also tell our people that cancer is curable, and you have got so many ways and means of treating cancer completely. And one prerequisite is early diagnosis. So that message should go on. So I am very happy that JDN has taken up this huge task, of organizing this webinar on the Cancer Day. I wish all the delegates to have a very good time in this webinar, and also thank all the faculties for agreeing to speak in this webinar. I welcome everyone once again. Thank you, Dr. Venkatesh. Over to you.
Thank you, sir. Thanks a lot for being with us always, sir. Now I request the chairman of IMA Cancer and Tobacco Control Committee, Dr. Dilip Kumar Acharya, sir, to share a few words with us.
A very good evening to all of you. At the outset, I'd like to convey my sincere thanks to Venkatesh and his team, all IMA JDN, for organizing this important webinar on the occasion on the eve of World Cancer Day, which was started in 2000 by UICC. I'm also a member of UICC, and I've attended 2 of their World Cancer Congress also, organized by UICC. Basically, IMA, this committee is also known as the Cancer Prevention and Tobacco Control Committee. I proposed this committee way back in Goa CWC meeting, I think it was 2009 or 10, where the proposal was accepted. We started working on it. And since then, we are doing a regular organizing various events on World Cancer Day, World No Tobacco Day, World Cancer Awareness, Indian Cancer Awareness Day, then World Head Neck Cancer Day. So there are so many days coming up. And at the IMA level, what we do is basically, we try to organize lectures. Then we arrange webinars. Then we press notes. Then we request rallies on Tobacco Day, a lot many other activities. What I do normally is I send a letter to the headquarters, and then they circulate it among all the members, especially the president, secretary, all the state branches and the city branches, which we have about 1,800 city branches are there. And we request them to organize this thing so that the things are percolated down all the ways also. We are in touch with the WHO also and the government of India, if we can get a sponsorship, because we want to, as we all know, tobacco causes about 13 different types of cancers, which is most preventable. Alcohol causes another 7 types of cancers. Obesity causes about 11, 12 types of cancers. And these are all preventable causes. So we can say that now we can say that cancer has become a lifestyle disease also, so that we can work on together, so that we can work and prevent the disease. Almost 33 to 40% of cancers are preventable. And we are working mainly on that aspect also. The government has also given a good support a number of times, but still the lack of many things like tobacco. We have insisted that government should increase the taxes. So if government increases the tobacco taxes, it is known that our 10% rise in taxes reduces consumption by 8%. Similarly, cervix vaccination, we are after the government that it should be included into the national vaccination program, because that is the most best way to prevent cervix also. And Dr. Abul Hassan has rightly said, early detection is the key to many cancer prevention, working on the cancer treatment. We are working on that also. So we coordinate with the WHO, with the government, and nowadays we are also working to tobacco cessation is the main thing. So we'll work on that, highlight and train our doctors into tobacco cessation. So if more and more people come up, and because once we tell people tobacco is bad, they want to. It has been shown that number of people want to quit. More than 50 to 60% want to quit, but most of them do not remain quit after a long time. The cold turkey is the best way to do it. That certain decisions they want to quit, but still they need some support sometimes. Also, we have chewing gums also, we have other drugs also available, which we have to work on that. So by National Cancer, as I said, National Chairman of the Cancer Tobacco Control Committee, with all the members also who are actively working all throughout the country, we have been working and continue to work on this aspect of prevention of cancer, early detection of cancer, and tobacco control also. Once again, thank Dr. Venkatesh for giving me an opportunity to talk about it. Thank you very much.
Thank you so much, sir. Now I'd like to introduce our panel of experts. Our first panelist is Dr. Kwartalan Chowgle ma'am, who is a breast oncosurgeon and oncoplastic surgeon, currently working as an assistant professor at the Tata Memorial Hospital, Mumbai. Welcome, ma'am. I would also like to welcome our next panelist, Dr. Daksh Chandra sir, intervention radiologist, currently working as an assistant professor in Tata Memorial Hospital, Mumbai. Welcome, sir. I also take immense pleasure in welcoming the next expert, who is also from my same state, Dr. Suresh Kumar sir, a consultant medical oncologist from Kauvery Hospital, Chennai. Welcome, sir. With this brief intro, let us get straight into the session. Participants can type their questions in the chat box and we will answer them at the end. So starting with the session, I have collected few FAQs about cancer gap. Our panel of experts will be answering those one by one. So proceeding further, first I would like to ask Dr. Chowgle ma'am to throw some light on the importance of public education and awareness about cancer prevention. Over to you, ma'am.
Good evening, everyone. Worldwide as well, the incidence of cancer is increasing. Similarly, in India, the incidence of cancer is increasing rapidly. So we need to step up the cancer literacy and knowledge so that it leads to early detection and diagnosis, and which we thereby will translate into better prognosis and survival. Like, for example, in women, breast cancer is globally, it is the most commonest cancer. Similarly, in India, it's one of the most commonest cancer. But because of ignorance or because of the fear or because of the social stigma attached to it, women don't come forward and seek help. And when they present at a much advanced stage, which results in aggressive management and extensive treatment. So this can be overcome by patient education. Similarly, cervical cancer amongst women is the second most commonest cancer. And it is there are screening tests available, but that has to be women have to be made aware regarding that. And if it is detected in a pre-cancerous stage, then we can even cure it. Similarly, whether it is oral cancers, like sir just told us, and whether it is lung cancer. So if we increase the awareness about tobacco chewing and the harmful effects rather of tobacco chewing and of smoking cessation, and how we take it from there, then a lot of cancers can be prevented. And oral cancer and lung cancer is common amongst men and women, and it is one of the leading causes of mortality. So we need to tackle that, and that can at least to a large extent it can be prevented by creating awareness. So objective of any awareness program should be to educate the people regarding the cancer, then detect the signs and symptoms early, and then also lifestyle changes that need to be introduced. Then the screening tests, like for example, again in cervical cancer, that pap smear is available, so they need to know that they can detect cancer early by that. For breast, mammography is available, clinical breast examination is available, so they need to be made aware of all these things, and then it can be really helpful, and we can try and percolate awareness and prevent cancer to some extent. Yes.
Yeah. Thank you, ma'am. Thank you for the detailed explanation, ma'am. So I would like to request Dr. Daksha. I'd like to ask him to brief us about the role of modifiable risk factors in the context of cancer. Sir, you're muted.
Hi, everyone. Good evening. So modifiable risk factors are, they certainly go a long way in preventing cancers per se. Like Dr. Dilip had just said, he had charted down quite a few of the modifiable risk factors that are there. Also, it depends on the behavioral. You basically have to act on the psyche of the person, and these are behavioral changes. You can bring about change in people and help them to stop doing that behavior which causes which can lead to cancer in them. So what are the certain modifiable changes that can be brought about is cessation of tobacco consumption, as sir has said. Then apart from that, yes, obesity, weight control, physical activity, then alcohol use, and then obviously vaccination, HPV, HBsAg, HCV, and in certain people, yes, sun protection and overuse of other medications like in postmenopausal hormone pills, which can cause cancer as well. So these are all modifiable behavioral changes which can be brought about. So what we have to also think about is, now we have the knowledge, at least the doctors have the knowledge, we have to percolate it down the society. And it is not just percolating the knowledge down the society, it is helping them improve. Okay, it is, our job doesn't just stop at spreading knowledge. Yes, it is important, it's one of the most important parts, but yes, you have to create a one-on-one personal relationship with the patient, so they feel comfortable in sharing information with you. That is how your history will be good, and a patient will find it easier to talk about anything with you, and it's fine. I mean, that is what we are here for. So I think if we can bring about that change, and identify the subjects who need help, these modifiable risk factors can be taken care of, and I think it will really help the people, our patients who come to us. So it's always important to educate them about what can be done, what are the treatment options that are available with us, and how can we help them prevent this. So it's a partnership between the patient and the between the patient and the doctor. And I think if you make your patient feel comfortable with you, yes, you can really help them in preventing cancer or any other preventable disease, not just cancer, even let's say cardiovascular or stroke or anything else. So it's one of the most important things. Yes, education and taking the treatment to the patient.
Yes. Thank you, sir. Sir, as a continuation of what you said, I would like to ask, what do you think are the challenges which affects the complaints to the advice which you give as a specialist?
So the compliance, see, the first thing is the most important thing from what I feel, what I've dealt with my patients is that you need to make them comfortable. If the patient is not comfortable with you, they will not talk to you, or they will not feel comfortable to share their personal information, because sometimes patients do come in, especially the genital cancers, patients are not very open about it. You really have to make them feel comfortable about it. So you have to be able to talk to them. You have to and compliance, it is the attitude. You have to build up the attitude of the patient. See, there was a study in which they said a patient with cancer who has a positive attitude and a patient with cancer who has a negative attitude, so the compliance to treatment is 2.5 times lesser in a negative attitude patient than in a positive patient having a positive attitude. And also this attitude, I mean, it is a variable, it is a mood dependent, it's a variable word. I mean, I would say an attitude can change also. And how do we bring about that change? It is about talking to them. It is about talking to their society, to their family members. A lot of times people hide having cancers from their own relatives or from their workplace. Why? Because they might not be ki mere ghar wale kya bolenge. It's something like that. Or some people think that it is essentially a death certificate that they get, so they might not be able to work. So it is not like that. I mean, if a disease it got early, it is very much curable. So we have to teach them, and this education should also be spread around to their families, to their workplace, and there has to be a mindset change. It is not that you've given the information, here's your pamphlet, you read it, this will help you. No, you sit with the patient, you talk to them, you sit with the family members and talk to them. And how can you help them, and how, in what ways, what are the treatments that are there? So some of these aspects are very important. And I think if you make your patient feel comfortable, if you talk to their people, and you bring about a change in their attitude and a healthy change in their attitude, the compliance of the patient to the treatment is very good. So that
Thank
is
you,
one
sir.
of the things. Yeah.
Thank you, sir. Thank you for the detailed answer, sir. So next, moving on to our next question, I'd like to request Dr. Suresh sir to take this question. So can you share with us the importance of early detection in cancer?
Yeah, of course. So early detection is the most important thing for improving survival of our patients. So most of our patients come very late, at a very late stage to us, when the chance of cure is significantly reduced. So early diagnosis is very important for diagnosing for complete cure of the patient. Also, cancers which are diagnosed quite early in the stage of the disease, the patients also have very good general condition. When it is being diagnosed at a very primitive stage, early stage, like stage 1 or stage 2 or pre-cancerous stage, where the relative general condition of the patient is preserved, the chance of the complete treatment, the radical treatment being given to the patient is very high. So, suppose the patient is presenting very advanced stage, they may not be very fit also. So, one, the chance of cure decreases. Second, the chance of the treatment being delivered to them also decreases. Most of the patients who present with very advanced stage of disease, they may not be fit for chemotherapy or any other treatment also, even surgery or radiation or chemotherapy also. So main important thing for early the thing is for early diagnosis, improving the survival of the patient. The chance of cure is significantly higher. The chance of maintaining adequate quality of life also is very high. So we have a very good screening test for certain cancers where we can detect the cancers at a very early stage. Example, if we take cervical cancer, we have a pap smear test which is being done from 21 years of age. Every 3 years we have to do pap smear test. And also we have for breast cancer, we have breast self-examination, we have mammography, which has to be started from 40 years of age. So like prostate cancer, if we take, we have a PSA screening test for patients who are high risk from 45 years of age. So all these tests are actually have to be incorporated into the routine medical checkup of every patient. So usually most of the people in our country, they ignore all these health checkups, and they unfortunately land up at very advanced stage.
Thank you so much, sir. I'd like to go back to Dr. Chaubey ma'am again. Ma'am, where do you think there is inequality in cancer care, and what can be done to minimize this gap?
So like you mentioned in your introduction, Venkatesh, so there is, it could be at the level of education, it could be level of income, and it could be simply the geographical location, or sometimes, a patient will be discriminated against because of the gender, the race, ethnicity, age of the patient, or any disability, or any lifestyle choices. And what happens due to this is that and unfortunately those who are disadvantaged, they also have poorer lifestyle choices, or they're exposed to unhealthy diet, or they will have more exposure to tobacco, and also they will have environmental exposure is also more amongst these persons. So we need to try and reduce that, and that gap can be only reduced by increasing the education of these and regarding the preventive techniques, and also by directing more income towards on and increasing the resources. Then you need to equip the healthcare, also healthcare persons need to be more skilled. Their knowledge needs to be increased so that they can provide better care, and they should know and be aware of this inequity and the damage that can cause to patient care. Similarly, even for each region, like whatever the cancer is in that area or that country, we need to come up with policies that can help prevent those, and take it forward from there. So I think that is what these are the gaps that is available, are present, and how we can overcome them as well.
Okay, thank you, ma'am. And I'd like to direct the next question to Dr. Daksh sir. Sir, what are the stigmas associated with the cancer patients, and how can we address this issue?
Okay, so the stigma that goes around is, I mean, what is stigma? You have to really understand that it works on the psyche of the patient, right? Again, as I was saying. So what are I mean, there will be, okay, you have to understand that it is a non-communicable disease, but some people think that, okay, cancer, so it will be difficult for him to do anything. You have to make, I mean, it is difficult. Most of the people lose their job also, because some people, I mean, their bosses don't think that he can take care of the job that is provided to him. Apart from that, these patients undergo depression. Okay, they have poor self-esteem, they build up anxiety, and they isolate themselves socially. So imagine that when you have a disease which needs to be treated thoroughly and you have no support with you, people are not with you, they try to shun you, they don't want to deal, I mean they don't, I mean you're pretty much left alone. If your parents if your family is not educated about cancer and they don't know what it is, they might not help you, they might not be able to support you. So if your bosses or if your workplace people are not educated about it, they might not be able to support you. And cancer is a disease which requires a lot of funding to be treated. Okay, most of the fund that comes will come out of the pocket of the patient. It is a very expensive disease to have, and I've seen patients spend shelling out nearly all of their money to get treated. Also in young patients, again related to genital cancer, one of my friends in my childhood had developed CA testes, and he had not told anyone about it. So he was very careful whom to divulge. He shared with me because he was close to me, and I was already a doctor at that point in time. So you have to understand the psyche of the patient and where it is coming from. Why is it that in our society it is difficult for people to talk about their illnesses? Okay, so that has to be addressed. It is there because people are not informed, people are not educated. Yes, there are certain celebrities who come out with their cancer disease treatment as well. Some people have breast cancer, some people have CA lung, and they go ahead with get treated. These you see majorly in metropolitan cities. You will not see such openness about disease in a rural setup. Or कि वो क्या बोलेंगे, अरे उनको ये हो गया. There's a sense of guilt associated with having cancer as well, and guilt and shame that people, okay, they might have, okay, he smoked cigarette, he got CA lung, that is his fault. No, it's not like that. Okay, there was a trigger, you got a disease. You have to be strong enough, mentally fit enough to be able to accept that, and you have to come to a facility who will provide you a good treatment. So that is where your psyche starts to change. You talk about it, you discuss. There are cancer help groups available. There are so many hospitals available. There are supportive measures. People who care about you, you can get, doctors can educate them, and they can form a support system for the patient who's undergoing the treatment. As it is, the treatment is very difficult for cancer. You have hair loss and you have everything. People find it shameful to go in front of people because of that stigma. Weight loss ho gaya hai, you're losing hair, there's skin pigmentation, rashes. It's a difficult time for them. So what can you do for them is make sure that they are comfortable. Apart from the treatment, obviously you have to make sure that that they are comfortable. And how is that possible? We have to make them feel comfortable, the society has to make them feel comfortable, and that has to be brought about by discussing openly about the treatment options, openly about the cancer and the process and the toll that it takes on the patient and the family and the society. So once we all come together, I think I think cancer will no longer be a stigma, and people will openly discuss it. And once people start to openly discuss it, we start to pick up cancers faster. Once we start to pick up cancer faster, our cure rate increases. So that is something we need to take care of.
Yes, sir. Thank you, sir. Thanks for the wonderful explanation, sir. And since you touched upon the expenses part, I would like to request Dr. Dilip Kumar, sir, to to throw us more light about the health insurance part when it comes to cancer management. Whether the government insurance, this Ayushman Bharat thing, will be covering this cancer treatment, or if I'm having a private insurance, will my private player will be providing my adequate cancer cover? What all things should I consider before taking a health insurance policy with context to cancer?
Well, the Ayushman Bharat has really been a game changer as far as cancer treatment is concerned. Nowadays, we are able to, because I'm a surgeon also, we see that many patients who are really very poor, couldn't afford a proper treatment, are coming to us. And I always well covered with Ayushman Bharat also. Similarly, private players also, they cover that nicely. But the problem is, people are not getting proper insurance to that level with the amount they need for a cancer treatment part. Because cancer treatment, as Dr. Daksha just said, it is a very costly affair, especially the chemotherapy and other things. I think my state, Madhya Pradesh, was the first to be, before the Ayushman Bharat came, to give up free chemotherapy treatment to all the patients. And they had started chemotherapy centers in all district hospitals also. So the chemotherapy was free for all. But the only point is that people do not complete their courses. One. Secondly, they start the treatment nicely. First, so we always stress, as a committee, I'm always stressing that if you can prevent it, the best thing is. If not, get it the early diagnosis, the other best all around is. Because if I am able to diagnose an oral cancer in early stage, I do a small surgery and the work is done up with. But it comes to late stage, it has to be a very mutilating surgery along with radiotherapy, chemotherapy, and everything involved with that. But as we said, Ayushman Bharat, known in some states, in Rama in some other states, or one way or the other, the government coverage of late has started on cancer also, and which has been really very good for all the cancer patients also. But because of COVID, there has been some delay in the treatment of many patients, which also we have to take care of that. But now with the COVID going down, we are hopeful that all the patients will be able to reach the good proper cancer centers and get the best of the treatment possible.
Okay, sir. Thank you so much, sir. And I'd like to ask my next question to Dr. Suresh, sir. Sir, what are the measures of strengthening primary healthcare deliveries in community so that the cancer can be identified at very early stages in the grassroots level?
So we can see that a lot of cancers, majority of the cancers in our country are from rural areas, since the majority of population live in rural areas in our country. And these people, they have inadequate knowledge about cancers. And we as already discussed, we know that a lot of stigma is attached, especially in the rural areas. Most of the patients don't present to the doctor at early stages. So they usually stay at home and come to a very advanced age. So first, most important thing is cancer education. About educating the patients about the signs and symptoms of cancer, about what are the treatment modalities available, what are the preventive strategies available. All these things must be taken to the patient level, at grassroots level, must be implemented at all the health centers or the primary health centers, sub-centers, everywhere at the primary level of contact with the health center. All these facilities should be made available. Similarly, patients, the people also should be made aware of all the symptoms which the cancer can present with. So the patient should be educated about the common signs and symptoms of cancer, when to approach the doctor if they have any particular symptoms like that. And also they should be made aware of all the screening tests available. So we have all these screening tests for cancers, which are also available at the basic grassroots levels at the health centers everywhere. But most of the people don't utilize these tests. So all these tests should be made more accessible, and also people should be made more aware of all these. Next is the proper referral system also is required. So we don't have there's a lot of discrepancy in referring the patients. So a proper referral system, like when to refer which patient for higher care. So this system also has to be strengthened. And the other thing is a lack of regular health checkup on the part of the patient. So regular health checkup must be devised. So when to, what frequency they have to go to the doctor. So all these has to be made educated to the patient.
Okay. Thank you so much, sir. Back to Dr. Chowdhury, ma'am. Ma'am, do you think there is a significant difference in cancer-related outcomes in rural when compared to the urban areas? If so, what do you think are the factors responsible for such a difference?
Yeah, cancers in urban India are, there is more cancer that is detected in urban India, but the mortality is lower, right? Similarly, in rural India, so there are fewer number of cancers, but the mortality is higher in the rural areas. So now this could be due to various factors. So in urban areas, there we may have, the population may be more educated, they may be having better economic status or income resources. Their cancers may be detected at an earlier stage, right? And they will seek help and take the entire treatment. Now in rural areas, first of all, accessibility to treatment, that is a factor. Okay, then they may not have the resources to take the treatment, then they present later because of lack of awareness or like the social stigma that we just discussed. Due to all these reasons, they present late. So they present with advanced disease. Then by the time they reach a tertiary center, there is a significant delay. And then the prognosis and survival thereby goes down. And it is not as like when you look at cities or urban areas, then the women or men, the cancer survival is better. So although the number of cases detected is higher, again, that also there may be more centers, cancer centers, etc., etc. So due to all of this, then there is definitely a difference. And again, like Dr. Suresh spoke, that how we can improve is increasing awareness, and they should be made aware of all the screening tests that are available. And like, for example, in there are 19 states in the country where there are ASHA workers are trained, and they go and they perform a breast examination for women, so that breast cancer is detected early. So similarly, more measures such in the rural areas can, if their cancers are detected early, then we can have better outcomes. And in urban, then we need to make lifestyle changes where we can reduce the number of incidents of cancer. But that will, I think, take significant time and effort. So yeah.
Okay. Thank you so much, ma'am. Back to Dr. Daksha. Sir, in our country, there is a vast difference in the availability of cancer care. Like, many hospitals are concentrated in metropolitan cities, like where you are, and the availability of hospitals, cancer hospitals in rural centers is really scarce. How do you think we can minimize this gap?
Okay, so I totally agree with your statement that there is a vast difference between the rural healthcare and the urban healthcare system. So what can be done is, let me talk about the Tata model. So now Tata is opening up hospitals and pairing up with hospitals in each state. Okay, so Tata has opened up now in Guwahati, in Sangrur in Punjab, in Vizag, and some few other places. The other thing that has come up is something called as National Cancer Grid. Okay, so what has happened is, from all over India, Tata and other hospitals have selected and differentiated depending on their infrastructure, the hospitals which can help patients with cancer treatment, right? So they divide in L1, L2, L3 depending on the infrastructure, L3 being a higher level and L1 being a lower level. So now in each state, they are pairing up with at least 2 to 3 hospitals. Tata is supporting those hospitals by providing them with machines, back-end support, everything, so that the patient does not have to come to us. See, there's a lot of money involved with treatment as such. Okay, so now if a patient has to go to a metropolitan city or a urban city and stay there, eat there, live there for a cancer treatment, which takes a very long time, it bears a significant amount of burden on them. Okay, so now if we can provide cancer treatment to them at their own state level or near their house, it'll be really good for them. They won't have to spend, instead of spending on staying and everything, they can just directly spend on their treatment facility. Apart from this, there is something called as Navya Care, which has Tata started. It is basically an online service. So a person sitting in Jammu and Kashmir who wants to fine, okay, he has got some investigations done, he's been diagnosed of having this, if they want to take a second opinion, let's say from Tata or from any other hospital, so there's a panel of doctors present in Navya. So you go online, you fill your forms, you submit your diagnosis and everything, and some doctor will contact you. People from Navya will contact you and tell you about your treatment, your prognosis, what will happen in the next stage, what you should be getting, and how to follow up. So all these things are now available, okay, via the web as well. So things have become easier to reach. But yes, there's still a gap. Apart from that, Niti Aayog is there. Niti Aayog, what they're doing is they've identified rural non-communicable. There's a document about treatment of non-communicable diseases in rural India from Niti Aayog, and they're trying to implement. What they want to do is they want to build up infrastructure. But yes, infrastructure is not the only thing that will help. You also have to have young doctors who are willing to go to rural India and treat patients over there. Most of the doctors, most of the specialists, because of lack of equipment or infrastructure in rural India, they try to shift to a metropolitan place where they have equipment to work with. So if that can be provided along with willing doctors who are who would like to go to the rural India and treat patients over there, yes, I think that will really help us bridge the gap. And things have started on a positive in a positive direction. A lot of the youngsters, they do want to go back to their own state or where they live and start providing medical health treatment over there, not just with cancer, with any other thing as well, which is a good pattern. So I think if this pattern carries on, I think it will really help in bridging that gap. And best of luck to us if we can do that.
Thank you, sir. Sir, I'd just like to ask, you are mentioning about Navya. If I want to avail that service, how can I avail that service, and how much should I be paying for that service?
So Navya, it's a bare minimum service. I think it's in a couple of $1,000 itself. If you go online, you type Navya Tata Memorial Hospital, you can go onto the site. There's Navya Expert Opinion Service, that is which has a panel of top oncologists from all over India, not just Tata, from all over India. And you can fill out your forms, and there's a minimal fee. It's not very expensive, and you can avail your opinions. I mean, your help from other oncologists, or your second opinion as well, if you're not satisfied with what treatment you're getting.
Okay, thank you, sir. Sir, I'd like to ask Dr. Suresh, sir. Sir, being a medical oncologist, what do you think the institutes and government can do in order to encourage patients to participate in clinical trials?
So basically, clinical trials we see is a multi-center collaboration. You can say a lot of centers come together and do a clinical trial. So we can say the clinical trials is at a very primitive stage in our country. So only premier institutes like AIIMS or Tata Memorial Hospital, those are the places where clinical trials are being conducted. The rest of the country, we have a huge patient load. We have a lot of clinical material, but the clinical trials are very minimal. So one, we can say, because there is a lack of multi-center collaboration. There is no collaboration. We don't have a proper regulatory framework also, from the government side also. So that we have to work on to improve the collaboration between the various centers, so that we can increase the number of trials. Second is funds. Obviously, for funds, we need a lot of, for conducting clinical trials, we require a lot of funds to compensate the patients, to give the drugs, everything. So funds is really an issue in our country. Unlike the Western countries where they have a lot of funds, also a lot of pharma companies sponsored trials will be going on. So that is a very important issue here. So by increasing the funding, maybe we can increase the number of trials as well as patient enrollment in clinical trials. The next is government support is very important. The government should encourage the hospitals and the centers to conduct more number of clinical trials. That is very important. And also another important thing is the doctors are too occupied with the clinical work. So we see a single doctor sees a lot of patients. They don't have adequate time for the clinical for research work. So if you see, take Western countries, the work is split equally between clinical work as well as the research work. So they have something called OPD days, where they see 2 or 3 days per week only the clinical work. On the rest of the 2-3 days, they allot it for conducting research. They don't come to OPD, just sit in the lab or do research or something like that. So that is definitely a long thing to go in our country, where doctor can devote their time for clinical research as well.
Thank you, sir. Ma'am, Dr. Chowgle, ma'am, would you like to add anything apart from what sir said? In order to encourage the patients to participate in clinical trial, what can the government do?
So more like, actually, like he rightly said, so we need to encourage more centers to be first of all involved in clinical trials, and you need a good amount of support to conduct these trials. And like Dr. Daksh mentioned regarding the national cancer grid, so we have some trials going on where we have other NCT centers, and Tata has collaborated with them so that we can carry those trials. Most of the time when we present our trials internationally, one of the drawbacks is that it's a single center trial. It's not a multi-center trial. So we are currently having many trials along the NCG platform, and that is being taken care. But the thing is, patients also need to be counseled, and that has to come either with the clinician that is involved, with their patient care. And we have to, so the enrollment is actually always 40% in clinical trials, but we need to, and we are at par with the international clinical trials also, but we need to encourage patients. So I mostly try and tell them that, the treatment that you're receiving now was, because somebody has participated in clinical trials. So even patient education is equally important. And of course, we need good support from the government, to us take this forward. And we need not be, far behind, and need not always blindly follow what is being practiced in the West, because our population is different, and we need to have our own trials and come out with our own outcomes, so that we can treat our patients in this region accordingly. So definitely government support with the funding, with having a multi-center trial, all these things are extremely important.
Thank you, ma'am. And I'd like to ask my final question to you, ma'am. And what do you think is the role of social media in closing this gap for cancer?
Yeah, so social media is a double-edged sword, I'd like to say. So the good thing is, like during the pandemic for us, we've been doing teleconsultation for our patients who were not able to come to Tata, and even all our follow-ups, we had called them. We have arranged either teleconsultation or just through phone calls, and made sure they're doing okay, because you had to divide it during the pandemic into those who need prior care on priority, those who can be kept under observation, and those who are in intermediate category, things like that. So during that time, I would say it is an excellent thing, and we're still doing the teleconsultation. But social media, if you're providing the right information, when it's coming from the government or it is coming from a healthcare organization, the right information has to be conveyed to the patient, like the correct preventive measures or awareness, etc. But fear, or like there are certain myths, for example, in breast cancer, that using a deodorant or wearing a tight garment, all those things cause cancer. So this negative information or wrong information should not reach the patients or public. So if the right information is being conveyed to them, then yes, definitely social media is today a very important part of all our lives. But also then we need to get down to the grassroots level, and in the rural areas we need to have like reach them, which either through ASHA workers or whatever is convenient, but we need to have both the things going on simultaneously, for sure.
Thank you, ma'am. Thank you, ma'am. So we are almost close to the end of the session. Thank you so much to all the panelists for the excellent session. Dr. Chowgule ma'am, Dr. Dakshandra sir, Dr. Suresh sir, Dr. Dilip Kumar sir, and Dr. Abdullah sir. Hope the knowledge gained from this webinar will be of immense help to our junior doctors, especially those who have always wondered about the challenges in cancer care. Thanks a lot for your time, despite your hectic schedules. So we are coming to the far end, and let us take a few questions from the audience. We have 250 plus registered participants in today's webinar. So before audience they are giving their questions, let me invite you for our upcoming IMA JDN events. On Sunday, that is on February 6th, we have an orientation session to ICMR STS, that is Short-Term Studentship Research Program, where experts will be answering the FAQs on this ICMR STS. On Feb 15, we have an orientation session to NEET-PG 2022, where toppers of NEET-PG 2021 will be sharing their study strategies. You can find the registration link for these events in IMA JDN Facebook and Instagram pages, as well as in my personal profile. So coming back, let us check the chat box for questions. So we have a few questions though. Dr. Ravindra Manohara has asked to explain better about what is the exact meaning of care gap. So Dr. Dakshar, will you be able to take this question? Sir, you're muted.
I didn't get your question. Can you repeat that question, please?
Sir, what is meant by a care gap?
Okay, so care gap is basically when there is health requirements from the public which is not being met by the health providing facility. Okay, so there are more number of patients who require services from a health professional, and it is not being met. It is just not that you have to provide them with medication. It is that health can be mental, physical, and everything. So the doctor has to treat the patient as a whole. You have to approach them in that manner. So health, if you want to cover that bridge, you have to be there for them, mentally supporting them. Obviously your treatment protocols are there set. You have to be able to do justice to the patients providing who have come to avail your services. And yes, I mean, if you can bridge that gap, it's great. I mean, and what we need to do is we need to, even our young junior doctors, they need to not all of us should run towards metropolitan cities. I think there is a lot of work that is available in the rural India, as we had discussed. So most of the urban society is able to achieve that healthcare that is needed, because most of the hospitals, as we had discussed, are concentrated in urban India. So the gap that is being talked about is majorly from, let's say, rural India or the second tier cities as such. So where good health facilities need to be provided. We are trying to bridge that gap by providing services online, by building hospitals in their own setup, by taking other hospitals under the wing, uh, and teaching them, and various specialists from Mumbai helping or teaching the other doctors how to go about and do things. We are trying to do that. So that pattern is already in place, but yes, it is taking some time to reach there. Hopefully, in the next 5 to 6 years, we should be in a better place. But yes, all the efforts that will be required is to make sure that our next couple of years, we that rural and urban dissociation that is there. If you need good medical treatment, you have to go to a big city. That needs to be closed. We as healthcare providers should be able to provide services at every level, at every place. The We should take the healthcare to the patients instead of patients coming to us for healthcare services, because they are already suffering. You don't want them suffering more by traveling and coming to you, right?
Yes. Thank you, sir. Thank you, sir. Dr. Dilip, sir, would you like to add something to this? Like explaining what is meant by care gap? Sir, you're muted.
This is the theme given by UICC for next 3 years. UICC as well as a member of that, so we gave a theme. So because this country that is not only in the rural or urban in our country, but because UICC covers the whole of the world, so to say. So it is between the developed and developing countries, underdeveloped countries also. There's a lot of gap between the care to be for a care. Doesn't mean just palliative care. It is all the treatment part also, in the awareness and everything. Anything concerned with cancer, there's a lot of gap or a difference between the urban and the rural area, between the developed and underdeveloped or developing countries, and all those things. So what UICC aims is that this gap should be closed, or at least should be narrowed down as best as possible. So Dr. Darshan rightly said, because in our country also, the rural and the urban, a lot of gap in between that. The availability not only of doctors, but of facilities also. If we talk about radiotherapy units, like linear accelerator, LINAC and other things, they're all available only in the metros only, or maybe with tier 1 cities. So we hope that in the future, the cancer treatment will be available in the smaller cities also, that people don't have to run away from smaller places and look forward to going to the Tata and other places only. So that's the basic aim of UICC. The next 3 years, they want to highlight close the care gap. That's the main thing. Thank you.
Thank you, sir. So one of our participants has asked a very important question. Are there psychiatric or the psychiatric calls being done for cancer patients regularly during the complete course of treatment? Would any of the experts like to answer this?
Yeah, I'd like to take that. So this is a very important aspect of treatment and cancer management. It is very emotionally draining, not just for the patient, but also for the family and the people, caring for the patient. So unfortunately, I don't think that enough emphasis, although yes, psychological support is provided, psychiatrist is there on campus and they are referred. But I think we need to have more support groups as well in the country, and that idea needs to be made more common, and people need to know that such facilities are available. It is very much it's common in the West more so, but in India also we need to we have regular classes. There are women support group or any other for other cancers as well. There should be so other more psychological support is required. Psychosocial issues need to be addressed. And although they are at risk, but it's not enough, and more work needs to be done in that area. And patients need to be not always just financial support, but they will require, whether it's requiring some help at home, and all those things also need to be looked into. And psychological support or psychosocial support is a very important aspect of cancer care, and we definitely need to pay more attention to that as well.
Thank you, ma'am. Thank you, ma'am. Is Dr. Abulasan sir available with us? Dr. Abulasan sir? Yes, sir. Sir, I just wanted to ask one question to you, sir. So, like past several years, you have been running a terminally for a care home for terminally ill cancer patients. You have spent a lot of money. You have seen them personally. How do they suffer? How are they being treated by their family? So, with this experience, vast experience and background, what do you think the government and the institution should do to close this gap in cancer care?
Exactly. Very importantly, government has no plan to take care of our terminal cancer patient as on today. That is the very pathetic scenario in our country. Most of the terminal cancer patients getting palliative care at a government hospital, whichever hospital is nearby. And the terminal care also is not up to the standard of the care which some of the patients are getting in a cancer. So most of the time it is only very a kind of mild symptomatic treatment only they get. That is the reason I organized this palliative care center in my place. It was inaugurated by none other than President of India 16 years ago. So far we had managed 1,300 patients till their last breath. That means all the patients, they came in the last stages. They lived from few months to even a year in my hospital. I raise funds from other sources, charities, doctors, hospitals, they provide funds. And we are managing for the, none of the even, not a single day our center was closed. Always there are patients, always there are attenders there. We cook food for almost 30 to 40 people every time in a day, every meal. So that is that people are giving all the funds. What is that? Even I have written an article in the media, newspaper, and spoken in TV channels that there should be a concrete plan to take care of these terminal cancer patients. There should be a separate budget allocation for this. I also fought with this insurance company and have developed a separate plan for palliative care. After that only, they have now a plan for cancer palliative care, including chemotherapy, palliative chemo, palliative RT. All these things now they have included in the plan. Earlier it was not there. So what I should say now is to answer your question, that it is a big area which needs good attention from government side, particularly that in Western country there is a huge difference from the in the life of terminally ill patients in the West and terminally ill patients in our country. There is huge difference is there. The difference is suffering. All our people are suffering only, the huge suffering. All the patients whom we lost in our center so far today, that they lived a very pathetic life in their houses. We did somewhat kind of gave them better life by way of giving nutrition, by way of doing some counseling, some entertainment in the last few days. I can tell you that CA breast 4-stage with the liver secondaries lived for 1 year in our center. It was really unbelievable, and all because of the nutrition and this thing lived for such a long period, and then she ultimately died. So definitely this palliative care needs a big boost in our country. We have lots of developments in the cancer care. All these things we discussed now. So much development, so many new drugs are available today. But what about the palliative care? This palliative uh, um, uh, spinal anesthesia or epidural anesthesia still not becoming popular in our country, which we are doing probably in Tata Memorial Hospital, and for every patient for pain relief, we will be doing this. But in most other places, it is not being practiced. They have been getting only analgesic, this one, that one, ketanol, tramadol, all fortwin, all kinds of analgesics are just like that pumped into the bodies of terminal cancer patients without scientifically approved. This is a huge science. There is, I am really sorry to say that there's a huge difference between the managing palliative care patients in the West and also in our country. A huge difference. So that area to be addressed. We give them a respectable, should give them a respectable last days of their life. Many people ask me, many women, they ask me this question: why do you suffer like this? What I have done in my life? What mistake I have done in my life? I get up early 5 o'clock every day and cook for my family, cook for my children, cook for my grandchildren also. And suddenly they come and say that I have cancer. So they want to take her to some place. Finally, they have brought her to me to take care of the rest of their life, rest of her life. That is the scenario. So we all of us have that responsibility to see that these people, I suggest all of you, some of you might have read this, Chasing Daylight by Jenny O'Kelly. It's a wonderful book written by terminal cancer patients. Wonderful book. So that kind of, life, which is planned, which is respectful, and also painless, both in the body and the mind. So that has to happen. I think the cancer days are done every year, but there is little progress in the life of terminal cancer patients. I have worked in seeing many of the patients die by holding my hand. Even at the last breath, I have watched them. That there is only one thing I could see in their eyes, that what they are going to do for us in the future. That is a question before us. I think we have to go a long way to answer this question. Thank you, Venkatesh.
Thank you, sir. It's very inspiring, and it's very touching to know your experiences, sir. So going further in the session, I request Dr. Siddharth from Youth Cancer Action Network to brief about the activities of Youth Cancer Network in addressing this gap in cancer care.
Hello everyone, I'm Dr. Siddharth Murekar. I'm currently working in King's College London. I'm director of Youth Cancer Action Network, and today I'm with such a esteemed panel. I'm really feel myself very honored to be with Dr. Acharya, Dr. Chaugule, Dr. Chandra, and Dr. Hassan, who have worked extensively in their fields. So today I'm representing YCA, and the first question is, what does YCA do? So we are taking such small baby steps in working towards what our panelists have been mentioning about throughout the session. So we are trying to create nationwide awareness of cancer, its risk factors, preventive measures, and encouraging regular checkups. As everyone supports this, that catch them early and treat them soon is what the slogan should be for cancer. So we are trying to take a step forward in that regard only. Dr. Daksha had mentioned about stigma concerning with the cancer patients, and it's very important for them to sit with the patient and discuss. So there is a gap that needs to be bridged, and we are trying to be there in some cases wherein the doctors cannot sit with the patient and bridge this gap. Dr. Chaugule mentioned about awareness regarding cancer, and that is what we are trying to do via engaging in social media and every kind of stuff. And soon we will be trying to go at the ground level as well. So providing early detection of cancer through awareness and programs is what our main motive is for YCA, because internet has reached a lot of places during the COVID times and due to the recent boom in the internet in India. So that's why holding such sessions, at least one person in the 250 plus participants can get help regarding this regard, such as Navya, as mentioned by Dr. Chandra. So wherein they can approach, they can approach where to go in such regards. Dr. Acharya mentioned about funds and screening, which are very important. So we are, taking baby steps in raising funds for poor cancer patients across India. Dr. Hassan said, suppose it's very necessary whenever the cancer treatment, especially the terminal cancer treatment, is concerned. And we try to support the patients during and after the treatment. And generally, these are poor patients which have very basic issues such as accommodation, rehabilitation, and getting them in touch with the survivor groups. We try to collect data. As this is about the patient side, we try to collect data through the population and provide some analysis about what may be the incidence of cancer in specific region or something, which in future can help for cancer research. Our main aim is to be a better country and be a better position when we step into the next day. So we try to promote oncology related research and publications among UG Med students, which we are starting as soon as possible. So that is in brief about what the YCA does. And I'm really thankful for giving me opportunity to represent YCA. And especially thank you for Dr. Venkatesh to be such a nice host for the evening. And IMA JDN to be here. And everyone, esteemed panel, I really feel myself very honored to be with such good people. Okay, thank you so much. And I hand over my mic, my screen to Dr. Venkatesh. Okay, thank you.
Thank you, Dr. Siddhartha. Moving ahead, I request the national convener of IMA JDN, my mentor and the public health expert by himself, Dr. Shiv Joshi sir, to give the vote of thanks.
Thank you, Venkatesh. First of all, let me thank you for arranging this very important session today, a panel discussion that you've brought together lots of experts in their own fields. And it was really heartening to see the experiential type of discussions that were happening here. Moreover, when we talk about cancer in India, we see that we need to have a holistic approach. So we always talk about preventive to palliative care model whenever it comes to cancer. So it is very important to understand this continuum of care that we need to tackle the issues like cancer. So these are very different from the routine communicable diseases that we see, where one point of intervention might just be enough. But for diseases like these, like cancer, we require a more comprehensive preventive to palliative care model. If we also see, if you look at the recent findings from the GloboCan studies, which involves findings for around 36 different cancers across the globe, you would find that they found a very interesting relation between the Human Development Index and the premature deaths that happen due to cancer. That is something what I think Dr. Daksh Chandra was also trying to point out. The death gap or the survival is very different in the Western countries compared to our own country. And it mainly arises because of two big problems, which I think Chobli ma'am was also trying to mention, as well as I think Dr. Dilip Acharya sir has mentioned that. The real problem in India is twofold, because one, our cases are presenting late in our OPDs, and second, we do not have adequate resources to treat all these patients. So that makes the problem twofold. The solution to this looks simple. It is actually simple, but it's not easy to execute. When many of us have actually suggested doing health education, health promotion activities, our friend Siddharth Murekar, Dr. Siddharth Murekar is also working towards those lines. What happens is, though the process is simple, create awareness, invest in the preventive measures, and you will get better return on investment. But doing that is not easy. So we need to understand advocating for more funds towards preventive care, advocating for, because these treatments, they become very costly and they are very much preventable, as we saw during this discussion. Tobacco is responsible for so many cancers that are preventable. Alcohol is responsible for the cancers that are preventable. So, and actually preventing them is much less costly as compared to treating them. So that advocacy has to come from the doctors. That's what I feel at this moment after listening to this varied and very vivid experiences shared by Abul sir also. The last days of a person's life and how they have this question in front of them, what you are going to do for us, I think the answer is that it is simple, but we have to come forward, advocate, and make it happen. And that's what our role can be in this Cancer Day. Thank you, Venkatesh, for bringing this to us. I also thank Dr. K.M. Abul Hassan, sir, who is always there with us in these sessions, who guides us through this process, who is also the national chairman for the standing committee. I also thank all the esteemed panelists, Dr. Dilip Kumar Acharya, sir, Dr. Chogale ma'am, Dr. Daksh Chandra, Dr. Siddharth Murhekar, Dr. Suresh Kumar, everyone. And I thank Clarinet for being a very good host for us and giving us this platform. I also thank all the attendees for bringing us some really interesting questions that triggered these discussions today. And thank you, everyone, for being here and giving your time for this activity. Thank you. Over to Venkatesh.
Thank you so much, sir. Once again, I would like to thank our expert panelists, Dr. Chowgale ma'am, Dr. Daksha, Suresh sir, Akshay Singh, Dr. Dilip Kumar, Dr. Abul sir, Shiv sir, Karan, Dr. Siddhartha, Dr. Dilip sir, and all our 250 plus registered participants for making this webinar a great success. Thanks a lot, everyone. We are closing now. Thank you.
Thank you.
Thank you. Thank you, everyone.
Thank you.
Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Thank you.
Thank you so much, doctors. We're closing here for today.